Let us now go to our gait training portion. I would like to impart to you the general considerations in using different assistive devices. First, stay on the posterolateral side of the patient or on the weaker side for support and standby assist. Number two, make sure that the patient's elbow is in 20 to 30 degrees flexion when using any assistive devices. Okay, let us now go to the actual training. See you! Welcome to our walker gait training portion. This time we will instruct the patient to stand up from sitting position using a walker. The case is the patient's affected leg is his right leg, non-weight bearing or partial weight bearing. First, you will instruct the patient to scoot forward a little bit and then hold on to the walker, and without putting weight on his affected leg, lean forward. Make sure that the shoulder is in level with the knee, and then push your body using your arms. Okay, that's good. So the same procedure applies when you are instructing the patient from standing to sitting position. So instruct the patient to move backward until his good leg touches the edge of the chair. And then the same, lean forward first, not putting weight on the affected leg, and then move slowly downward. Okay, and then scoot back. Okay, that is from sitting to standing and standing to sitting position. Let's see you in another portion. We will go now to the actual training using our walker. So first, standing from sitting position, like what we did before. Okay? Patient, let us now stand up. Okay, that's good. And then, the pattern that we will use is swing to gait pattern. Non-weight bearing or partial weight bearing on the affected leg, which is the right leg. Okay, instruct the patient to move the walker one step away. And then bad leg, and then good leg. Okay. Walker, bad leg, and then good leg. Walker, bad leg, good leg. Okay. Walker, bad leg, good leg. Walker, bad leg, good leg. And now we will do the turning. The same procedure applies. Walker, turn the walker slowly. Bad leg, good leg. Okay, walker, put your weight on your arms. Bad leg, good leg. Walker, 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 bad leg, good leg. Okay, that's it. Now we will go now to using the walker in unlevel surfaces like ramps. See you. Okay, this is now the portion that we will teach the patient in using walker in a level surface like this ramp. Be sure to instruct the patient to make a little bit movement first. Small steps, small movement of the walker. And be sure to instruct the patient to lean slightly forward. That is for stability and to lower down the center of gravity. The pattern that we will use in going upward is walker first, and then the good leg, and then the affected leg. While in going downward, we will do the pattern of walker first, bad leg, and then the good leg. The rule of the thumb as therapists, we are using good go to heaven and bad go to hell. So for easy memorization of the pattern. Okay, let's start now with using the walker in going upward. Be sure to stay on the posterolateral side of the affected side of the patient. Okay, instruct the patient to move the walker slightly forward. And then the good leg, small step, and then the bad leg. That's good. Walker, good leg, and then bad leg. Walker, good leg, and then bad leg. Now, assuming we are now going downward, okay, let's turn. Assuming we are now going downward, okay. So this time, I will stay on the anterolateral side of the affected leg for support and stability. Now, the pattern that we will use, as I said before, walker first, bad leg, and then good leg. Now, instruct the patient to slightly lean backward to lower the center of gravity. Okay, now let's move the walker slowly forward, bad leg, and then good leg. Walker, bad leg, and then good leg. Walker, bad leg, and then good leg. Okay, that's it on our training on unlevel surface. See you on next portion. We will now go to the next part of our gait training. This time, we will use a pair of crutches. First, we will instruct the patient to move from sitting to standing position. So, let us assume that the case of the patient, the affected leg is the right leg again, partial weight bearing or non-weight bearing. So, in instructing the patient to stand up from sitting position, first instruct the patient to put the crutches together on the dominant hand. And then instruct the patient to slowly scoot forward without putting weight or partial weight on the affected leg. If the chair has an arm, the patient can use the arm in pushing himself upward. But if not, if there is no arm, the patient can use the side of the chair in pushing himself upward. So this time, instruct the patient to slowly lean forward, shoulder in level with the knees, and then slightly push himself upwards, pushing the weight on the arms. Okay, while standing, transfer the other crutch on the other side. Okay, be sure that the clearance of the crutch support from the axilla is 2 finger breadth, like this one. And be sure to stand in a tripod position, meaning 4 inches anterior, 6 inches lateral to the toe. Okay, now let's try from standing to sitting position. Okay, let's place both crutches together on the dominant hand, and then instruct the patient to lean forward slowly, reaching to the edge of the chair, and then slowly put himself down, and then scoot backwards. Okay. Now we will go to the actual training program. Okay. This time, we will go to the actual training crutch using program. In using crutches on level surfaces, there are 4 techniques that we are using. First is the 3-point gait. Next is the 4-point gait. Next is the 2-point gait and the swing to and swing through pattern. Let's start first with the 3-point gait, with the affected leg in partial weight bearing or non-weight bearing status. Okay? As we are doing before, stay on the posterolateral side of the affected leg, and then instruct the patient to move both crutches 1 step forward. Okay? Crutches, bad leg, put the weight on your arms, and then the good leg. That's good. Okay, crutches, bad leg, and then the good leg. Crutches, bad leg, and then the good leg. So that is what we call the 3-point gait. Now we will go to the 4-point gait. This is stable, but it took longer than the 3-point gait. First, let's move the left crutch forward. Left crutch, affected leg, right crutch, and then the good leg. 4-point gait. Left crutch, affected leg, right crutch, and then the left leg. Okay, 1, 2, 3, 4. 1, 2, 3, 4. So that is our 4-point gait. The 2-point gait is much easier and lesser time. This time, the left crutch and the right leg or the affected leg will move at the same time. Okay, left crutch and right leg, and then right crutch and good leg. Okay, 1, okay, and then 2. Okay, good. 1, and then 2. So that is our 2-point gait. Now we will go to our swing to and swing through gait. So the term implies when we do the swing to, the patient move the crutches forward, but while he move both legs forward, he will not pass through the crutches. Swing to. And when we say swing through, the patient will move beyond the crutches. Okay, let's try. Okay, instruct the patient to move both crutches forward and then don't go beyond both legs. Okay, that's good. Crutches forward, don't go beyond. Okay, that's good. That is the swing to. When doing the swing to, the patient will move both legs forward beyond the crutches. Okay, let's try the swing through. Okay, that's good. Next. Okay, so that is our techniques in using our crutches. Now we will teach the patient to use the crutches in going on level surfaces and stair. See you. This time we will teach the patient in using crutches in level surfaces like this ramp. So the same techniques apply. When going upward, good leg first. And when going downward, bad leg first. Okay, now let's do it. Okay, first instruct the patient to move the good leg upward, bad leg, and then crutches. Okay, that's good. Good leg, bad leg, and then crutches. Good leg, bad leg, and then crutches. Good leg, bad leg, crutches. Be sure while doing this, before doing this, to instruct the patient to lean forward a little bit for stability and to lower down the center of gravity. Now, assuming we will go down this ramp. Okay, let's turn. Okay. This time we will teach the patient in using crutches in going down this ramp. Okay, our technique is crutches and bad leg and then good leg. Be sure to stay on the anterolateral side of the affected leg for support. Okay, and then be sure to instruct the patient to lean backward slowly and a little bit. Okay, now let's move both crutches and bad leg at the same time. Crutches and bad leg. Okay, that's good. Good leg. Okay, crutches and bad leg and then good leg. Crutches and bad leg and then good leg. Crutches and bad leg and then good leg. That's it. Next, we will teach the patient to use the crutches in going up and down the stairs. See you. Okay, this time we will teach the patient to use crutches in going up and down the stairs. So our technique in going upward is good leg first and then bad leg and crutches. In going downward, crutches and bad leg and then the good leg. So be sure to stay on the posterolateral side of the patient, on the affected side when going up, and the anterolateral side in going downward. And be sure to hold on to the guard belt. That is important in providing support. Okay, now let's teach the patient going upward. Good leg, and then bad leg and crutches. Okay, good leg, bad leg and crutches. Okay, good leg, bad leg and crutches. Good leg, bad leg and crutches. Now, assuming, now we will go down the stairs. Now we will teach the patient in using both crutches in going down the stairs. Okay, crutches, bad leg, good leg. Okay, crutches, bad leg, good leg. 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 That's it. So now we will go now to the other portion of our gait training, which is using quad K. See you. you